Have you ever felt like your neck is made of cement? No matter how much you stretch it or roll it or whatever you do, it just always feels tight. Let's break down what's going on with your neck and what you can do to relieve your symptoms for good. Today, we're going to be talking about what causes neck tension, who is most affected, and what you can do about it. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I hold a PhD in orthopedic manual physical therapy and strongly believe that movement is life, and you deserve both. So many people often say, I just carry my stress in my neck. And that may be true, but why is your neck tight all the time? So when we're talking about neck tension, what exactly are we talking about? A feeling of constant tension or stiffness that limits how much you can move. Now, this can be caused by tight muscles, it can be caused by fascia that is limiting the motion, and it can be caused by joints that are not moving correctly. Over time, it can lead to headaches, jaw clenching, and poor posture. Who is most affected by neck tension? Well, ladies, it tends to be us, and it tends to be after we're 35. And it especially increases during perimenopause and menopause. Although you may remember increased neck tension after you had children because we tend to spend a lot of time in that forward posture as we're nurturing the babies. Also, desk workers, caregivers, and anyone who is carrying mental or emotional stress. You also might be suffering with neck tension if you have poor posture, a weak core, or limited upper back movement. You may be watching this video and being like, well, I don't really know if I always have neck tension. So what are some signs you can look for? If you are frequently rubbing your neck and upper shoulders, you have limited range of motion, or you can't turn your head fully to look over your shoulder. Many people don't necessarily know if they have limited range of motion, but they do realize that they can't check their blind spot when they're driving. And if you suffer with headaches that start right at the base of your skull, that can be from neck tension. And if you've tried massages or you've tried heat, maybe even ice, and only found short-term relief, then you're going to want to watch to the end of this video for some things that you can implement right now. If you're getting benefit from this video, please click that like button and don't forget to click subscribe so you can get more content on healing without surgery. So why does neck tension happen? Well, the most common cause is poor posture because we're in that forward bent posture where our head is not on top of our shoulders and our neck is having to work really hard. Now, one thing that a lot of people don't know is that if your upper back is not moving correctly, you also cannot lift your head up on top of your shoulders because you're stuck in this position because of the upper back not moving correctly, which causes you to lift up to keep your eyes horizontal, and that puts a lot of compression on those neck muscles too. Many of us in today's society use these accessory muscles of respiration to do shallow breathing. So we end up using these muscles up in our neck, which are only meant to help in a true fight or flight, like I need to run away from a bear type of situation. But we are constantly in fight or flight, so we tend to overuse these muscles and underuse the diaphragm, which is the big muscle that's meant to help us breathe deeply. This can also happen if we have emotional stress or are just overloaded by what's going on in our world. We will have increased neck tension if we're compensating for a weak core, if we have a shoulder instability. Many of the muscles that start at the neck attach onto the shoulder. So if the shoulder is unstable, then the muscles will try to tighten up to help hold that shoulder in position, which can lead to neck tension that can't be resolved. We have to deal with where the instability is or the weakness in the core in order to allow those muscles to release. Okay, so what can you do about it? I'm going to give you my top tips that I give to my patients in the clinic to help relieve their neck tension and keep it gone for good. Now, I will say that these exercises need to be repeated regularly because we want to make sure that we're using good posture and good exercises throughout the day to keep our neck tension away. First thing I want you to do is some daily breathing exercises. We will link a video here on how to do that proper breathing, but it's important to make sure we're doing it to calm the nervous system, activate that vagus nerve, and decrease tension to the neck muscles. If your upper back is not moving correctly, then we want to make sure to do some stretches that are going to help improve that mobility. How do you know if your upper back's moving correctly? When you're in a seating position without any back on the chair, are you able to sit up and put your head over your shoulders and your shoulders over your hips? If you find that you're stuck in this forward bent position where the head is trying to fall off the shoulders, then chances are good that you don't have that mobility through the upper back that you need. I am a big fan of gentle neck stretches, doing the ear to the shoulder. You can even try to look underneath the shoulder. You can look forward and try to stretch all through those muscles. There's nothing wrong with doing those exercises to try to help decrease your symptoms, but if they haven't worked to solve the problem thus far, keep those exercises and stretches, but add in some of these other tips. Now, we really want to strengthen those postural muscles so we're able to maintain that proper posture on a regular basis. So things like shoulder retraction or scapular retraction, where you squeeze those shoulder blades together, will help to improve the shoulder position and thereby decrease tension on the neck. If you do sit at a desk for prolonged periods of time during the day, you're definitely going to want to work on your workstation ergonomics. So you don't want to be sitting at a laptop where you're like hunched over because the screen is down here and that's where the keyboard is as well. You want to make sure that everything is in a neutral position. So you want the middle of your monitor to be at eye level. You want to make sure you have some support either for your elbows or underneath your wrists with a wrist support if you don't have support on your chair, and that you're able to maintain that neutral position while working for prolonged periods of time. Now, I also don't recommend sitting for more than an hour at a time, so I do recommend setting a timer to make sure you get up every hour, walk around, drink some water, take some deep breaths before you get back to it. Another thing I want you to consider is your sleep position as well as your mattress if you find that you wake up with increased neck tension. Now, this is not for everybody, so not everybody needs to worry about this. But if when you first wake up in the morning, you feel like you have more neck tension and it actually relieves during the day as you do some motion, then this is something that you should definitely look into, because it sounds like either your pillow or your mattress or both are increasing your neck tension. Now, in my clinic, we do have another option to help deal with neck tension, and that is called Shockwave therapy. Shockwave provides a pressure wave that goes into your body to help improve cellular metabolism, decrease tension, improve blood flow, and increase strength. It also helps to break up myofascial adhesions, which stimulates healing at the cellular level. It is really helpful for people who have already tried all the other tips and done all the other things and still can't find relief for their chronic neck tension. It is also great to pair it with traditional manual physical therapy that is going to focus on things like getting joints moving, decreasing tension in the muscles, allowing the fascial system to move correctly. So this is what we used for a patient that we'll call Sarah. So Sarah was 40 years old, a mom of 2, and she had chronic neck tension no matter what she did. She had watched the videos, she had tried the stretches, and the thing that you need to understand about Sarah is she worked out on a day-to-day basis. She had even tried getting regular massages to decrease her neck tension, and was really good about things like drinking enough water, monitoring her diet, and trying to do everything she could on her own. So we did a regular physical therapy evaluation, and what I found during that time was that Sarah didn't have a mechanical reason for her neck pain. And what that means is that there weren't any joints that were stuck, there weren't any muscles that were so tight that they were causing this problem. She didn't have any fascial restrictions. Her mobility was pretty good. She could actually get into an upright seated position. And there wasn't anything I could put my finger on that was causing this chronic neck tension. So we discussed things like modifying her workstation, making sure she was drinking enough water, making sure she was doing her deep breathing, especially while she was exercising. And then we sent her over and did 6 sessions of shockwave therapy to deal with the muscular tension, deal with any pain that was in the joints, and decrease the inflammation through her neck and shoulders. With making some slight modifications to her daily routine and the 6 sessions of shockwave therapy, she was able to get the results that she was looking for. In that, she was able to sit at her desk for an hour without starting to get a headache. Now, we did agree that she would get up every hour, walk around, and drink some water to make sure that she didn't overstress anything. But she was happy to be able to make it through an hour because that meant she could make it through an entire meeting without that headache getting in the way. It also meant that she had enough energy to get up, get some water, do some deep breathing, and get ready for her next meeting. So when do you know if you need to see a specialist to get help for your chronic neck tension? The first thing I always say to people is if this is limiting what you're able to do in life or what you're willing to do in life, I highly recommend finding a specialist who can help you. And if you've already tried everything and you continue to feel stuck, I commend your efforts so far and hope that you can find someone who truly understands what's going on with your body. And if you're starting to get frequent tension headaches and jaw pain, I highly recommend that you find a specialist who can help you eliminate these symptoms before they progress any further. If your neck has been calling for help, please listen to it. If you're in the Maple Valley area, I would love to offer you a free discovery visit. And if not, we do offer online health coaching to answer all of your specific questions. If you're interested in the shockwave therapy, I highly recommend calling the phone number that's in the description box below, where you can contact somebody from Curamedics, which has the only FDA-approved shockwave devices in the United States. And they can help you find a shockwave provider near you. Now, if you're looking for some more help for your neck pain, I'm going to have you go check out this video over here.